Yes,
Kumar
sir.
sir,
Yes,
you
Kumar.
see the mute
Yes,
start button, participants Q&A. Next to that, there's a button called share.
yes, yes.
Can you hit that share?
Correct. But I've tried it couple of times. It is
Okay.
not allowing me to, do it smoothly. Like basic and advanced options are coming, and
Correct.
something
You
or
select a screen. You select the screen which has got your PPT.
no. That screen which contains the PPT is not coming. That's the problem.
Okay. Is it, sir? Okay. You are using PowerPoint, right?
Yeah, PPT.
Okay. Just a minute. Let me also put up a PPT just to check. Just
Okay,
a minute.
Padmashri, we are live on YouTube now. I got it, so it's fine.
So I'm just going to put up thing. I'm going to zoom. I'm going to hit share. Sir, you should be able to scroll and see Microsoft PowerPoint if that's the way. Don't present it.
Yeah, I think that is what I'm. Come again, Gautam.
Just don't hit the in Microsoft PowerPoint. You have an option to present.
Yeah.
Don't hit present.
Okay.
Just hit screen share,
Okay.
and then you'll hit the screen. You should be able to see it in basic.
Yeah, yeah.
You are not able to see it.
No.
I'm just testing it.
Yeah, we
You
can see
guys
it
just
now.
see.
Yes. Now it has come.
So this is my screen.
I know.
So sir, sorry for the, let's say,
No problem. Live
hit
on
share. Are you
YouTube.
sure you cannot see the PowerPoint presentation anywhere?
No, sir.
Why don't you send the email, PPT as email to any of us and we can share.
Yeah,
Yes,
we
yes.
have.
Yeah, we have it. We'll do that.
Yeah.
I can do that.
Yeah.
Maybe you just have to say next. And
Just keep saying next and somebody can present it.
Yes,
Yeah.
yes.
Okay,
I
shall
think
I?
it's time we start.
yeah, we're gonna start. Gautam?
Yeah. Yeah.
Yeah, right. Okay.
Yeah.
Good evening to one and all present here, the attendees and the panelists. My name is Aishwarya, and I'm here with Padmashri and Monica, and we are a small team that's well operating a local chapter of this international movement called Conscious Cities. Conscious cities are basically cities that are aware and responsive to the needs and activities of the people. So we have been trying to put together events which are multidisciplinary and holistic in nature in terms of addressing urban issues. And for the past 2 days, we have been conducting an online webinar series, which has been, of course, discussing how the coronavirus pandemic is really affecting built environment and what can we really do, what's really happening, and what can the post-pandemic cities really be like. So, and today we're going to be dealing with the ground reality of the repercussions of the measures that have been taken to deal with this pandemic. And we have Padmashri who's going to be moderating the session today. So I'm just going to
I think we'll just start off, get the ball rolling with today. What we're going to start off with is short introductions of our panelists. If you could just talk about what you're doing, where you're from, how maybe COVID is affecting your life in a sentence or two. And after we go around, I think Doctor has a short presentation for us, and I'll put up the questions that we were addressing in this panel. You could all go around with your 7 to 10 minutes, and we'll open up the panel for discussion. Does that seem clear?
Yeah.
Yeah.
So if you could start, maybe Doctor could start, and then we could have Gautam, Varun, Srinivas, Sri. Is that correct?
Thank you for inviting me for this. I am Dr. Naveen Kumar. I'm a professor of psychiatry working at NIMHANS. I also had the community psychiatry unit, and I am working as a consultant for Center for Disaster Management of the Institute and for forensic psychiatry, tele and legal aid services of the Institute. And I've been very closely involved with the disaster management work related to COVID. Also in the Institute, we have been running the National Psychosocial Support and Mental Health Services Helpline, after this pandemic has hit us, and we have been getting calls from all over. Also, we've been helping in providing psychological first aid and mental health services for those who are quarantined. We are helping the government of Karnataka, and also helping the ministry with a lot of IEC material. So that is my background, and I'd stop at this, and I'd request the other panelists to take over for introduction.
So, hi, my name is Gautam, and I work with Reap Benefit, where we are trying to map all sorts of efforts, supply and demand, or needs and demands of the citizens in the city. We're working with multiple groups like with Bengaluru, etc., to kind of understand where are the people who need support and understand where are the local places they can get support from and connect them. We're trying to kind of crowdsource some of this information so it becomes as hyperlocal and detailed as possible. I stay in South Bangalore in Baswangudi, and uh, COVID's been affecting us in a very interesting manner. For the old folks at my house, this is how Bangalore was. But when we look into the reality of how, in the corner of my house, there was a chart fellow, and we were very close to him, and he doesn't get his business, so which means his groceries and his house supplies are not very stable anymore. So we know the reality that it's an extremely challenging situation for a lot of people. So that's how it's affecting me.
I can go
Varun?
next.
Yeah.
I don't know.
Hey, everybody, and thanks for that, Gautam. My name is Varun. I work with Agami, and Agami is an organization that works in the law and justice space. We catalyze ideas that serve justice. Basically, what that means is that we look at the law and justice space as a very closed community of typically made up of lawyers, judges, etc. And what Agami is trying to do is actually bring in a lot of entrepreneurial energies into the law and justice space so that people from outside of these professions can come and innovate and set up businesses that actually further the cause of justice. In my personal capacity during the COVID-19 situation, I've been both within Agami and outside of Agami, we've been organizing a lot of peer-to-peer calls. We've done quite a few. I think Gautam was on one of them. We did one for daily wage laborers. We had done one for small and medium-sized businesses. And we've been doing a few others as well to get industries and communities together so that they're talking to each other and not duplicating some of the efforts that are happening on ground. Similar to Gautam, I've also been working with organizations to build mapping capabilities from within the organization so that they're mapping what sort of work they're doing on the ground. They're mapping the relief that they're doing, they're mapping demand for that relief as well. So that we have sort of a cohesive map of India where we can see communities that are being served and where there are deficiencies in areas where nobody is serving those communities. So that's a quick brief of me and what I do.
Srinivas.
Hi, my name is Srinivas Alavilli. So I'm part of something called Citizens for Bengaluru. We are working on mobility, sustainable mobility, as well as decentralization in municipal administration, things like that. At the beginning of this crisis, we tried to emphasize the importance of, the BBMP mechanism and the apparatus and the personnel to effectively, fight this battle. But I must say that we haven't gotten anywhere. As soon as the COVID thing started, everything became chief minister, this minister, that minister, this IS officer, and there hasn't been a BBMP council meeting until 2 days ago. Even 2 days ago, there wasn't a council meeting. It was a leadership kind of meeting. So from a CFB point of view, I must say that we are very disappointed with the way urban local government has been used or not used in this particular thing. I think it's a big lesson for all of us. But I'll come to that perhaps later in the conversation. I made some posts about migrant laborers and how all of us felt so terrible about it. I thought it's a great opportunity for people to understand what happens to 200 million Indians that are not aware of COVID, but they're painfully aware of what's in front of them. So that got me working with another group of people, which Gautam was referring to earlier, called With Bengaluru. We just, it started out as something called Project Uta, and I was the one who didn't like the name. I said, that's not the dignified name. So somehow we ended up with another name called With Bengaluru. But what it does is it basically tries to identify clusters of people, migrants especially, or even non-migrants, with ration cards, without ration cards, raise funds We are able to raise about 1.4 crores till now, crowdsourcing plus big corporate CSR kind of funding together. So we are doing that with a very, very amazing team called Hasrudala. They are the ground operations team. Apart from that, I'm also involved in the communications aspect from a government point of view. So at the beginning of this, I've recommended to the government of Karnataka that they use TikTok as a way to effectively communicate official news to the rural Karnataka because TikTok is an extremely powerful and very widely used platform. And to my utter surprise, within 12 hours, they created a government account, and now we have 75 lakh views on it, and all kinds of things are going on. So, and that's another thing that I'm involved in.
Thank you, Shri.
You are mute.
You're muted. You're muted. You're muted. We can't hear you.
Sorry. Hi, I should have gone before Srinivas so that the weight of his initiatives does not fall on me now. I'm very minuscule in what I'm doing. I'm a social behavior strategist. I understand human behaviors, work with teams to figure out how we can shift behaviors to, so that they can make good decisions. Right from, let's say, lorry drivers having to drive safe, or, people having to take anemia tablets. In terms of COVID, I'm not directly linked with the ground, but I'm more linked with the organizations, kind of working with them on how to transition from traditional work setups to remote working. I am an independent consultant, so I already do remote work. That kind of helped. And also within the facility that I am in, I'm an avid blood donor, and I tied up with the doctor in the facility, and we initiated a mobile blood bank from the nearest hospital, Narayana Hospital, and they came in, and the initial participation was like 4-5 people, and then eventually 14 people blood donated. And I do request all the viewers and the panelists, if you have that facility to bring in mobile blood bank, and you can donate, please do that. There is a lot of people suffering with thalassemia or cancer patients who need blood transfusion every 15 days, and the hospitals are running out of blood. Anything on today, what I'll be talking about later is about how we perceive risk and how we can cope with the future, uncertain future, with risky future, and how we can decide so that it's safe for us individually and for all.
Thank you. So I'm just going to introduce the questions that all the panelists were sent on the slide. Maybe can you guys see it? We have quite a diverse panel here, where it's going from large-scale organization to Shri, who's working with individual people. So what we're trying to see is what are associated struggles and challenges on the ground for a developing nation? How are the cities dealing with it? How is this pandemic affecting our mental health? What can we do to better understand and cope with the catastrophe? Is there a silver lining? How do we need to remember, reiterate, and learn from these circumstances? I think that's the major overall points that we're looking at today. And considering all of our panelists do work with the community and have an outreach, how is that base coming in today? I think would be a nice point to touch upon, because it's a common linking point across all the panelists. So I think me and Aishwarya will step out for a bit, and Doctor has a small presentation, and then we can follow with the panelists, 10 minutes of everyone's panelists. Is that clear?
Yeah. Can I start?
Yes, please. Oh, should we share the screen?
No,
Monica?
I think yeah.
Okay. Monica, we can't see it yet.
No problem. I think I have it on my laptop only. I'll just start speaking.
Monica, you're muted. Yeah.
Hello.
Yeah.
Yeah, it came up and then wait. So you want to do that again?
Is it visible? Is it visible? Can you see it now?
Yeah.
Right. Okay. Here we go. Doctor, can you see this on the screen? Can you see the slides
Yes,
on
now,
screen?
yes, I
All
can.
right. Okay. You can just prompt me and I will change
Yes.
the screen when you need me to.
Yes.
Yeah.
So thank you. I'll not be taking more than 10 minutes for this presentation. So I'll start by, I'll be talking about the mental health issues affected, though, by this pandemic. And it's also now COVID-19 is not just a pandemic, it's also a mental health pandemic, because it's caused widespread panic, stress, and anxiety in the public, fueled by many factors, including how rapidly it has spread, the uncertainty about its course, because nobody seems to know where we are all heading, what is going to be the duration of these restrictive measures. There is a lot of mistrust between people, and particularly against the authorities, the stigma the health workers are facing, and the worry about the special population. So all these things are, making this as a mental health pandemic also. Next slide, please. So, who are these people who are getting affected? as I've told you, general public, the COVID-19 positive patients also, the frontline health workers, suspected cases or contacts on quarantine, or those who have history. So basically, nobody is, spared. In one study in China, the general public, about 55 to 60% of them had, anxiety and stress related to this COVID. They were not at all, affected by this COVID thing by any sort of way. But even then, they had shown the prevalence is so, wide ranging. Next slide, please. So, what are these common mental health concerns among the general public? It is fear and worry about acquiring the disease, fear about family members, particularly if there are elderly at home, avoiding approaching the health facilities for fear of contracting illness, concerns about the general health of the self and the loved ones, change in sleep and food habits, worsening of the pre-existent medical conditions, and the substance use and abuse they can increase. Next slide, please. Next slide. So, fear of losing livelihood, not being able to work during this lockdown, worries that children are at home instead of going to school, like any mild fever or any cough that can be mistaken as, fear of contracting COVID, anger and irritability towards governmental agencies, worsening of, this I think I've already told. Next slide, please. So the other problematic behaviors that are seen in the general public are the hoarding behavior, the hoarding of groceries, masks, sanitizers, perishables, etc. And some people also are known to have very low health anxieties, and they also become problem to the system in the sense because of the carefree attitude towards the rule enforcement, and they are the ones they can lead to spread of infection and increase the risk of contracting infection. Next slide. So both very high levels of anxiety, health anxiety, and low levels, both are problematic. Now, that is about the general public. What are the concerns among COVID-19 positive patients? Now, this illness can be divided into two phases: the acute phase, wherein the acute symptomatic phase, and of course, the healing phase, that is a convalescence phase we call. What is known during the acute phase is about anxiety, the feelings of stress and sleep disturbances are commonly recorded, going by the previous related pandemics of SARS and MERS, about that occurred about 10 years back. And during the convalescence phase, depressive symptoms are noted, post-traumatic stress symptoms, unresolved grief, memory problems, like PTSD symptoms in the form of constant exposure to disturbing images and the statistics of the situation, and the rumination again and again about the contents of those experiences, irritability and anger outbursts can be seen, and of course difficulty in sleep with the nightmares. So these are some of the things that are seen in convalescence phases. Next slide, please. So not only the patients, even the health professionals like doctors, nurses, and other paramedics, the other health professionals who are working, they are known to have sleep disturbances because caring for a COVID positive person is not a simple thing. I mean, there is a high risk of always the high risk of and fear of acquiring this COVID, the separation from family members. For example, a doctor who is caring a COVID positive person, in one of the hospitals, what I came to know is that a resident doctor will have to remain in that ward for 7 days, and after the duty gets over, for the next 15 days, he will have to be quarantined. Only then he will be allowed to move out of that facility. So if that kind of a scenario is there, the separation from family members is there, or the stigma and discrimination that you people must have already come across, the discriminating the healthcare professionals is already there, and of course the extra working hours. I mean, all these can be related to the mental health concerns of the health professionals. Next slide, please. So the other big issue is concerning the pre-existing mental illnesses, patients who are already mentally ill, and they are on treatment, and most of the mental illnesses, they do require long-term medications. So now OPDs are closed of all major hospitals. So there is a real risk of stopping these medications, and then there is risk of relapses and recurrences. And this COVID-19 period can act as a very powerful precipitating factor for exacerbating the illness, like pre-existing illnesses such as obsessive compulsive disorder. People, are advocating repeated hand washing. For those with OCD and for those with compulsions of hand washing, this kind of messages coming from the TV or other social media, the compulsions themselves can increase. Worsening of safety behaviors, increased assurance seeking, this is known. And so since OPDs are closed, the accessibility of services itself is a big problem. So people are finding it difficult to move about at all. So getting access to the care itself is becoming an issue. So as I was previously telling, people tend to stop medications during this period in time, and they expose themselves to the risk of exacerbation. And of course, the issue of caregiver stress also is there. So during this difficult period, the stress among caregivers also will increase. Next slide, please. So the other important thing that is to be noted is the closure of alcohol and tobacco sale. So that has resulted in significant increase in attendance to the emergency rooms for those with alcohol dependence. They come with what is known as the withdrawal syndrome. Some of them do come with serious withdrawal syndrome. Already we are seeing our in the first week of the lockdown, 90% of our emergency cases was related to alcohol withdrawal and associated serious complications that we call as delirium tremens. Now, increased attendance is there. Self-harm behaviors, including suicidal attempts, this group of people are seen. Use of illicit liquor can increase, and increase in domestic violence. Of course, this period of COVID-19, there has been a note of increased domestic violence that is becoming a big issue particularly among such people. And of course, the sleep disturbances. These are some of the issues specific to those with alcohol and other substances use. Next slide, please. Next slide, please. And of course, there are mental health issues, for those who are quarantined or for those who are isolated. That is fears or worries and doubts. All kinds of doubts are there. Concerns about spreading or contracting the infection. I think that was So they don't know the uncertainty of the duration of the quarantine. There's lack of activity scheduling. So that leads to lots of boredom. So these are some of the issues related to quarantine and isolation. So after these, I'll also talk about how to mitigate these concerns in maybe about 2-3 minutes, and then I'll stop. One is to understand, and one is to understand that this is an unprecedented abnormal situation, and these forms of emotions is normal, in the sense it is to be viewed as normal reaction to an abnormal situation, that it is normal to feel sad, distressed, worried, confused, scared, particularly during a crisis like this. It is better to minimize watching media shows, particularly items that causes anxiety and stress, to rely on official sources for information, get the information only once or twice a day, get the facts and not rumors. Next slide, please.
Doctor, should I move to the previous slide? I think we skipped
Sorry.
that slide.
That's okay. That's okay. You move forward, madam. Yeah. So the other things that one can do is to protect others, like checking on neighbors, relatives for need of any extra assistance. Of course, digital media is there. Telephones, WhatsApp, video chats, and so many things are there. Technology is advanced. So that is one thing which we need to exploit at this point in time. Talk to trustworthy people, contacting friends and family. And of course, there is a risk of increase in the use of tobacco or alcohol to cope with emotion, and that is a negative form of coping. So one should advise stop using these things. And of course, to experience positive and hopeful stories and positive images, of looking at people who have experienced COVID-19 and who have come out of that those recovery experiences can be really positive. Next slide. Next slide, please, madam. Yeah, if one is staying at home, sticking to a regular previous slide, please. I think you've skipped one slide. Yeah, maintaining a regular routine, proper diet, proper rest, physical exercises, hobbies, digital connectedness. One should have a plan of where to go and seek help in case there is a problem. That is where you need to be aware of the nearby health facilities, how to reach them, where are the barricades, and so such kind of planning one should keep ready. And of course, one should have facts about one's own risks and how to take precautions to protect that. Like for example, the Arogya Setu app, which is there, which I thought is a very good method of knowing one's risk, and whether it's low, whether it's medium, or whether it's high. So such kind of factual information, if one can have, it is easy to plan further. Finding newer ways to reduce boredom, education about the illness, again and again this thing is coming, and of course the preventive measures. Next slide, please. So stretching, deep breathing and meditation, exercising regularly. So again and again, I need to stress that eat healthy, avoiding alcohol and drugs. Next slide. Stay engaged, like reading books or listening to music, watching movies, finishing leftover jobs at home. There are many things that one can keep occupied with to stay oneself, to stay engaged, oneself. Next slide. So talking to people once one is trusting about your concerns and how are you feeling. Video calls, talking to friends and relatives could be a couple of other things that one can do. Next slide. Yeah, so managing children is a particularly difficult task. So children have a totally different way of expressing their feelings. So one has to give time to the child or an adolescent to answer the questions and share facts about COVID-19 in a way that a child or adolescent can understand. Reassure them that they are safe. Let them know that it's okay to feel upset, and and limit the child's direct exposure to news coverage to avoid misinterpretation. These are some of the tips. Next slide, please. So try to keep their regular activities, regular routine. Of course, it's not an easy thing. If schools are closed, create a schedule of learning activities and relaxation activities. Being the role model for children, because children see the world through us as parents. So taking breaks, getting plenty of sleep, exercising, eating well, connecting with friends and family, the activities that I mentioned under adult category needs to be followed with children also. Next slide. The other group which is special is the elderly. They are particularly vulnerable. You all know that the COVID-19 is particularly dangerous if an elderly person catches it because of the weaker immunity and multiple other medical morbidities that they have. So do not ignore other medical needs and explore telemedicine and other virtual modes of consultation seeking. For those with no access to information, particularly who are impaired in hearing ability or seeing, providing accurate information in a way they understand is very necessary. And simple exercises for passing time at home. These are some of the tips that that one can use. Next slide. So for health professionals, scheduling the working hours, adequate breaks and rest, not forgetting to use the personal protective equipment, and virtual connectedness to the family, having peer support, talking to friends and colleagues, and sharing their experiences, sharing their positive stories and the negative ones also. And it's also been shown that if the superiors are supportive, then the experience of mental health issues are far less. So involving the superiors also makes a lot of sense, to extract the best out of health professionals during these tough times. Next slide. Next slide. Yeah. For those with pre-existing mental illness, telemedicine facility has come as a boon. I was just sharing it previously also. The government has come up with guidelines which are very, very facilitatory to them. And some of the initiatives are linking up to the local psychiatric services that are available. For some who are not able to travel, our district mental health programs in the state, they are actually going and delivering the medications at the doorsteps. At least if telemedicine is not possible, at least through telephone, keeping in touch with them, and then guiding them where to do, what to do, how to go about it. So these kinds of guidance, I think that those things can be done. The single most important goal for those with pre-existing mental illness is to maintain the stability, if they have one, by maintaining the adherence to medications. For those who are quarantined, you should provide facts, provide as adequate. Yeah, providing. I'm just finishing. Only a couple of more slides are there. For those who have quarantine, provision of facts, provision of adequate information as many times as they need or they want, and education and rationale for the quarantine, minimizing the quarantine duration as much as possible, ensuring the supply of basic necessities, daily activity scheduling, and also, I mean, try, and if the quarantine activity is volunteered, or if they try to understand the rationale, then the mental health issues or concerns will tend to be less. So I think these are some of the issues from my side as regards the mental health concerns related to COVID. And of course, the next couple of slides, there are the website addresses and the helpline numbers are given. After that, I'll stop. You can just go through those two slides and then I'll stop.
Yes, sir. Sir, I'm so sorry. I think there was a lag in my system, so I couldn't move the slides on time. So yeah, this is the last slide.
Yeah, I think these are some of the websites which give authentic information, and one can go through them for updates, and a number of self-help strategies also you can get in these websites. I think that's about it.
Okay.
Thank you very much.
Thank you.
Thank you. That was very informative, and we'll share these links with our people. Hopefully, everyone checks it out. If the panelists could come back on. So I think we'll all go around. Is that okay with maybe just Varun and Shri could start off since they're here. Other panelists also, please come on. It's nice to see everyone's face.
Gautam, do you have it?
Who's going next?
I think Gautam.
Sure,
Wow.
Gautam, start off.
No, you first. No, you first.
So Gautam is going now.
Yeah.
Gautam, you can go ahead.
Cool.
Yeah.
So we at ReBenefit basically we work with the belief that every young citizen can be the local problem solver. It started off with a very similar situation. We were young and we saw a lot of waste related problems in the city, and we just didn't know what to do about it. So we started kind of discovering what the actual problem was. We spoke to the people who were picking up waste. We tried to understand from people who were dumping waste. We tried to understand how it was going, where was it going, how was it actually disposed. So in a way, we started investigating the actual issue. At the end of it, we realized that in many cases, the number of people who are creating the issues outnumber the people who are solving the issues. And for the majority who are the people creating the issues, some of them also wanted to start participating in the solving of the problem. But the kind of questions we heard from them was like, can I really make a difference? How do I start? Where do I start? How can I reduce my own waste? Those are some questions which basically indicate that they had no idea on how to start solving their own problems. So with that, we started working with youth by enabling them to solve local problems. Could be in the school, could be in their college, could be in their homes, could be in their community, with the belief that as they solve a problem once, their own belief about the need to solve this problem starts getting created. Their own agency, their own voice gets created. And then and they become more aware of the local problems. This kind of enables a larger set of society to start getting engaged in solving these local problems. This is enabled by two technology pieces. One is known as the Solve Ninja app, where you can contribute local data points by reporting issues. You can engage the local community by creating campaigns, and you can submit solutions which have worked for you so that others who need solutions can pick it up and solve these problems. To kind of visualize what was happening, we created something called as a neighborhood dashboard, where you could see the local governance, you could see the issues which are being reported there, some sort of analytics. Then you could kind of see who are the people or the agencies who are in your own neighborhood, so that you can kind of go and engage them in solving these problems, and local campaigns. In a way, what we are trying to do with the neighborhood dashboard and the Solve Ninja app was to connect the people who wanted to solve the problems with people who were experiencing these problems so they could work together. When COVID happened, we found that it was in many ways a slight deja vu. We didn't know what the problem was. We didn't know how many people wanted help. We didn't know where they were. We didn't know who were providing help. So we just repurposed the neighborhood dashboard to create something known as the COVID neighborhood dashboard. I'm just going to share my screen so that you can quickly see what we have done before I go into the details. This is the neighborhood dashboard. This is the city of Bangalore. In case you want to kind of understand all the people who need help, you can select all this. If you want to see people who are needing help, you can find them here. You can see that there are families or there'll be individuals. right? And you'll see what their requirements are. If you're looking at places where you can solve these issues, you just have to click on the local government canteen or shelter homes or even the ration places. Since there are a lot of them, they'll take some time to load. These are all the places where you can pick up rations. In case you want to find a volunteer, you just have to click on volunteer. You will see the volunteers near you. And in case you want to see if there's any sort of success, you can click on this and you can start seeing some success. A lot of this data is from our work with Bengaluru. So thank you for that, guys. You can also see, like, this was one part of the need we realized people had. The second need we realized people had was, okay, great, these are all the places where I can either help or I can get help. Is there something I can do? So we came up with this button here called the participate, where there are two forms, which is called help the needy or volunteer, where you can basically either volunteer your own time or identify people who need help and help map them. So that way, somebody who's trying to help ensure that they get their resources can pick it up. From another source, we got a request saying, hey, can we start mapping where the local medical centers are? So we put those kind of testing centers, we put the quarantine centers, we put the first responders. All of this is here with their phone numbers. And we realized that we also need to start mapping places where there is good or poor social distancing. At least this will help the volunteers who are trying to do something about it identify these spots. So for example, these are spots where people have said there are poor social distancing. Right. And then we realized, again, if we had to look at providing support, we can't do it completely if we do not map the known settlements, construction sites, housing colonies, etc. So we put those up. Right now we started visualizing it with a map. If you have all this information, then your question is really, what else can I do? How can I help? So we created this thing called as local schemes. And this is how it loads. Basically, you can see all the schemes which are available to ensure food security. You can see how you can see places or people you can reach out to in case you want to help the elderly. This tool basically is now in a position to enable people to identify people who need help locally and help solve them. This is what we've been doing. Now, because we work with youth, one of the things we realized which was important was people after some time are tired of, at least the youth are tired of Netflixing, they're tired of streaming, then they want to do something contributory, something where they feel they've added value. So this is where the local crowdsourcing is coming in. We've seen a lot of interest to start crowdsourcing people who need help, local stores which are open, so that way they know the other people in the city know where to go, or even map volunteers close by, or even NGOs. So as a, I think the biggest problem which we saw in this situation was, where are people who need help? How do we identify them? How can we help them? And how do I know all the existing infrastructure in place so that I can support them? In a way, this tool helps identify all this. We are working on how to make this more user-friendly right now. So the facts doctor said, which was needed, was there. So thank you, and thank you, Srinivas, because with Bengaluru is a critical part of this effort. Over to you, Varun.
Thank you so much. That was very helpful.
Thank you, Gautam.
That was very informative. Would Shri like to go next? And then we could have Varun and Srinivas.
You got a little stuck there, so I didn't hear. So hi, I just wanted to bring focus on another aspect of mental health, which is our general decision making. To me, mental health is not just about anxiety and depression, but our cognitive wellness. How do we decide even in these stressful situations? So I want to bring focus on how we perceive risk, and are we actually living a life where safety is one of our primary ways we decide, which is actually not. We don't. Being safe is not our way of living. There are various ways we keep taking risks, right from speeding cars to playing with fire with our gloves and stuff like that on an everyday basis at the kitchen and not. So I'll just go through certain things that is relevant to our pandemic. The way we perceive anything that's risky is by feeling, and more than a data of, oh, this is good, this is bad, and so this is risky. This is not the logical way we decide. That's secondary to our nature. So if we feel risky, then we will be safe. And at the same time, the safer we feel, the higher risk we will take. Like in 2014, they brought back this helmet for boxing, because when people asked them to remove the helmet from boxing, because when people started wearing helmets, they took more hits. And similarly, if we wear seat belt, we tend to speed more because we feel safe in the car. Similarly, that's about risk, and we don't follow rules, we follow norms. Like within my facility, initially when the risk of COVID came in, there was no one coming out for a good 1 week. And slowly people started coming out, and then others saw others walking. And so now there are more people, there are kids walking, there are elders walking. So we don't follow rules. The rule is still there, that lockdown is there even within the facility, but we follow norms. We see what others do and we follow that. And then we want immediate rewards, which is we want to be instantly gratified, which is that is in the present, because a reward in the future, which is after the lockdown, we don't know what's going to happen. But right now I want to get out of my home, I feel frustrated, so we go ahead and do this. So what will this do? Because since the first day of lockdown, the one question that I have been talking about and thinking is this a long-term strategy? Is this a sustainable strategy? Like previous to Bangalore, I was staying in Delhi, and in Delhi we step out. I used to wear mask. We wear mask because the pollution is at an average, it will always be at severe, and it will go to hazardous, peak hour or non-peak hour. In Chennai and Bangalore, only during peak hour you have higher rates. Otherwise it goes to good or moderate. But in Delhi that doesn't happen. But still you can pick out among a crowd literally only 2 people wearing masks. And then similarly, if you go out with all the pan, spits and everything, sometimes it's not very clean. So you always fear the risk of, okay, I would touch a pan, which actually did happen to me in an Uber, right? So I come back to Bangalore now during the pandemic. We realized that it's the exact same behaviors that we are and the mental status that we are behaving with. We go out, we are wearing masks, we are making sure that our contact is limited. And Delhi has been a primary learning for us to know that all of us are not going to follow that. Why? In the COVID situation, the graph is going to be like this, that risk was salient at the time of the lockdown. So all of us were washing hands, making sure we had all the hand sanitizers. We were wearing masks and everything, and slowly frustration came in. So right now, all we want is, okay, fine, lockdown within my vicinity. I don't hear any risk stories. I don't hear stories of people getting affected. But right now, I immediately want to get out of the house because it's frustrating to keep seeing family members. It's frustrating to keep seeing the screen. So towards the end of the lockdown, what I suspect is we will have a sense of an illusion of control, that I can handle this, that we might be overconfident that, yeah, I'm wearing masks, so nothing will happen to me. Oh no, I am washing my hands. Or we'll be optimistic that COVID might not come to me. And it's based on understanding of how we perceive risk. It's an absolute possibility. So then what can we do about it? Let's look at risk management for that. Anywhere if you have a risk management, like let it be alcoholism, or let it be pandemic, let it be tobacco. The first thing is we try to reduce the risk by banning, or here in this case, lockdown. So the first management to risk is avoidance, which is fine, but that's not going to be a sustainable management rule. Then the sustainable management rule to risk is what? From the policymakers, from the government, all communications should be, it will be much more effective if it is emotionally provided, in the sense risk is a feeling, and we respond to emotion because we decide with emotions. Our brain decides with emotions. So if you tell us narratives of a person in this area, in this locality, so we had this and this is their experience, somewhere we will find a relatability with that story, and that will induce a saliency of risk in us, right? And another way is looking at sustaining these behaviors as a social movement. So encouraging the societies to be vigilant about your neighbors, encouraging society that it's not just for you, you get affected, you'll be affecting others as well. So creating those kind of communications, and also individually, if we start searching for information that is giving us that kind of emotional narrative information, that will keep our risk at bay, one. And two, we are emotionally driven in our decision making. So especially at the time of risk, like this pandemic, we should also put in our logical mind in, which means it's highly encouraged that all of us start looking at data, credible data, and use our saliency of emotion of risk and make a sound decision. That's kind of as simple as that about how we can perceive risk and how we can cope with it. One of the things that we are doing within my own facility is, again, it's very difficult for us to think about future, especially if the future is 1 month down the line, far into the future, and it's not the next day. How do we cope with it on a long-term strategy? So we have come up with like 17 pointers of let's do this, let's do that, let's do this. And strategy is yet to be fixed. The reason being, they don't, the Welfare Association is yet to feel the risk of acquiring COVID after this lockdown. Lockdown has given them a wall, and after the lockdown, no one is able to think. So if any of you are in the societies, it's high time that we start conversations around it, and we strategize for how are we going to cope with not acquiring COVID after lockdown. That's kind of that. Sorry, one more point. The last thing that I wanted to bring out is after coping that I expect there will be change is in 3 categories: the elderly, livelihoods, on especially the domestic workers' livelihoods, and the way we work. The doctor had also mentioned how the elderly are especially vulnerable, right? Like even I have my grandparents living in an independent house in a second-tier city in Tamil Nadu. And the biggest problem we faced then was how can we get the ration to them? Like what Reap Benefit is trying to do, we were struggling to find players like them who can reach to tier 2 cities and beyond the urban cities as well, right? So I'm hoping this pandemic will bring out app players in building a organized care system for the elderly. The second is the domestic workers. Very recently, I think they were legally actually acknowledged that you can have a minimum wage. But another thing, I mean, their livelihood is completely uncertain right now. There have been some owners who have given them money for the first 2 months, some owners who have not. And recently I did a project on women livelihood, resource poor women livelihood. And one of the key insights that we got was how aggregators like an Urban Clap or, construction aggregators are formalizing, are creating an organized platform for laborers, like, informal laborers. Forget the minimum wage. They're creating a system that this is the quality level. If you reach this quality level, this is the amount of money you get. And they rely on continuously giving them a demand cycle. And I'm hoping that kind of a livelihood, again, system, support system is developed for the domestic workers. And third is the way we work. A lot of my work got procrastinated initially because of lack of availability of people, because they were traveling. And most of my work is in collaboration with other teams or my clients. And suddenly everyone is available. They are at home and they have the time. And often if we go search for jobs, it's very rare that you see, we come across organizations that are comfortably open for remote working. And I hope that this is my other vision, that all the adaptations that we are trying to adapt with, all the behaviors that we are trying to adapt with during this pandemic will have a positive future. And one of them will be the way it will change the mindset of the way we would be working. And that's the final out.
Padmashri, unmute yourself. Lord of mercy. Varun, can we?
Varun, go ahead. Sorry.
No. Thank you, guys. I mean, great presentations by the panelists so far. I think, it's very clear that we're living in very different times, right? If I just think about all the things I was worried about 3 weeks ago, I mean, it's really funny. Like today, I'm worried about whether I have enough atta, whether I will get enough atta in the supermarket. These were things I would never even think about for more than a minute a couple of weeks ago. Our worries have become really basic, and I can only imagine, what people who come from less privileged backgrounds are currently going through, if this is a situation that the middle class is currently facing. When COVID-19 at first hit, it was, I mean, like for everybody else, it was a huge shock for us in Agami. We're a very small team. There are about 9 of us who work out of Richmond Road. We're quite used to working remotely, so it didn't really feel like our work had really been impacted. But we were definitely seeing an impact with some of the partners and some of the organizations that we work with. So it was becoming very difficult for us to function. In Agami, we, like I said earlier, we work in the law and justice space. We work with the courts, we work with the prisons. We're trying to bring about affordable legal services in India. And it was almost like overnight, the entire court system had suddenly shut down. The court had declared that it would only take up urgent matters without really defining what urgent matters meant. So is a doctor, for example, who's facing eviction both by his landlord as well as the society that he lives in, because the society fears that he might spread corona. If he decides to go to court to have his eviction stayed, is that an urgent matter? Is a wife who's going through domestic abuse at home, who's trying to seek relief from the court, is her matter urgent? So it was not really clear from the court what was an urgent matter. So suddenly everybody was in flux. In the best of times in India, justice has been inefficient. On average, it takes about 4 years for a case in court to get resolved. If any of you, either in the participants or amongst your panels, have a court case that you're currently going through, either yourself or in your families, you understand the pain of this. Property cases, for example, famously go on for 10 years, 20 years, 30 years. Entire generations die out before a judgment comes out. And now you're faced with a situation where the courts are no longer functioning, and the courts are a very physical entity, meaning there is no way, at least till now, to file a case digitally or electronically in a court. But suddenly COVID-19 presented this entire dilemma for the courts, and it was almost like overnight the courts had decided that they would embrace technology, right? So on March 23rd, the courts came out with an order that said they would now listen to cases via video conferencing. which was strange because there was a huge body of people, and I don't just mean lawyers and judges and civic society who were trying to get the courts to do this right from the beginning. But suddenly it was like, it took a pandemic to get the courts to actually listen. So now what judges are doing is they're actually, they've embraced video technology. They're using a very old video conferencing software because for some reason the government of India had procured several licenses a couple of years ago, but hadn't been really using it. So it presents its own unique challenges. We hosted a call with a couple of judges and senior advocates who were telling us, for example, more than 2 or 3 people cannot log in at the same time. Therefore, there are some participants in those cases who just find out about the case after the call is over. Also, judges meet at each other's homes to hear cases, which defies the entire point of social distancing. But at least at the very least, what's happening is that cases are now being heard online. But what is still not clear is how you can file a case online. That is still information that seems to be available to a very select few advocates and lawyers in the know. As a result, access to justice has become a problem. It has always been a problem in India. But now that access to justice has been restricted to merely online platforms, it is an even bigger problem. Now, the question that this presents is, how do we ensure that connectivity is available to everybody, not just the middle class and the rich, but also to the poor? How can you file a case on your phone? And if you don't have an internet connection, do you still have access to the courts? And is your access to the courts now subject to private players as well? Because internet connections in India are largely driven by private players. What is the role that BSNL plays in ensuring maximum access to connectivity, internet broadband connectivity? So a lot of open questions that I think over the next few days, the courts are trying to grapple with. What's interesting is that COVID-19 has brought about some new efficiencies. It's brought about these efficiencies in very cruel ways. But for example, earlier, if you were a person in Chennai who had to visit the Supreme Court in Delhi, sometimes you would travel great distances, plan your entire trip, land up in Delhi, wait for several hours for a hearing, and then in 30 seconds, the judge says, this hearing has been adjourned, right? And then you make your way back to Chennai, and that becomes a wasted trip. So a lot of wastages in the judicial system. Suddenly, COVID-19 has allowed lawyers and litigants to log into court remotely, have their cases heard, and if there is an adjournment, it is very quickly dealt with. There was a time, the courts are currently getting every court in India receives about 5 to 10 cases a day. But they were not disposing of as many cases a day. So in many cases, your case may only be heard 8 months after you file it, unless it's considered an urgent matter. So there are a lot of issues, I think, that the court is currently facing and grappling with. And what I think we've all realized within the law and justice community is that COVID-19 is really an opportunity for law and justice to accelerate itself into the 21st century. Agami, even way before COVID-19 struck, we've been trying to push the digitization of courts for quite some time. We held 2 challenges. In one challenge, we put up prize money of about 1 crore, where we invited organizations to come together and try and build a justice data hub. The problem that this was trying to solve was all of the courts in India have their own formats for putting out, for example, judgments. A lot of data that's held by the legal fraternity is held in silos. There was no way for all of these different organizations to share data with each other and benefit collectively from all of this data. So we saw an opportunity here to build a common platform where all of this data could be shared. An organization had won that particular grant and they're in the process of building that platform. And the idea is that once you have this data available to you, this data has this network impact of making access to data more viable. For example, some people cannot afford lawyers. In fact, most people cannot afford lawyers. So can you represent yourself? And if you have to represent yourself, what kind of information do you need to access before you can go to a court? And if all of this information is going to be lying only in the court systems, if it's only going to be lying in lawyers' offices, how does the average person represent themselves adequately? So by putting this data out there, just like you have access to Wikipedia, which is the world's knowledge all captured in one platform, we felt the need for India's justice system to have all of its information available on one common platform that is free to access for everybody without any gatekeeping. The second challenge that we put out was in the online dispute resolution space. For some reason in India, we think that the courts are the only empowered organization that can deliver justice. And in most countries, we've seen that that is not the case. You can have private entities through mediators and arbitrators who can mediate between entities and bring about some sort of a resolution. In India, for whatever reason, that has not taken off. But we put out a challenge. ICICI Bank was generous enough to say that whoever won that challenge by demonstrating that their platform was superior would get 10,000 cases that were languishing in court from ICICI Bank. And in one of the cases, in one of the initial test cases that ICICI Bank had given to this platform, the platform is called Sama, by the way. You can visit them on sama.live. Sama was able to solve a case that was languishing in court for 10 months. They were able to solve it in 23 minutes. That is really the power of online dispute resolution. So online dispute resolution is nothing but, two people have a dispute, let's say the bank in this case, and somebody who's taken a loan, they've defaulted on that loan. And maybe that person just needs a little more time to pay their loan. But for whatever reason, the process of the bank forces the bank to take that person to court, and then the court takes forever to resolve that case. So both the bank and the person who's taken the loan stand to lose, both in terms of time and in terms of resources. But on an online dispute resolution platform, you don't need a lawyer. The mediator acts as an independent intermediary, and they try to merely facilitate a settlement. Usually both parties are willing to settle at some point. And so the facilitator or the mediator is just trying to find what that point is. What is that common point where both of them are willing to settle? And if most cases like that can be solved through mere mediation, the courts will find themselves less bogged down by legacy cases. So Agami has been trying to identify who are these mass generators of litigation, and usually it is business and government who generate the vast number of cases. And can we persuade these entities to, before they go to court, try and reach a settlement on any of the 10 odd platforms that we currently have, and I hope it grows to many more. Can you come on to an online dispute resolution platform and try and reach a resolution very quickly? Also, most court cases, you will find yourself broke by the end of a case because they cost several lakhs to hire a lawyer. It is also in the lawyer's interest to keep adjourning because the longer they can keep you on a retainer, the more money they make. But on an online dispute resolution platform, typically you'll find yourself spending through the entire life cycle of a case no more than 5,000 rupees. So that, while it's still inaccessible for a vast majority of people, it is at least more accessible to the middle class. And there are ways of making it free and more open to lower sections of society who cannot afford even the 5,000 rupee entry fee. I just want to quickly conclude my comments. Law and justice plays a huge role in our lives. And, if I were to put an economic value to it, there's an organization called Daksh that did a survey, and they found that the inefficiencies of the court, and this is before COVID-19, was actually leading to a loss of 50,000 crores per annum, which is roughly 0.5% of India's GDP. If COVID-19, if anything, if we see this as an opportunity to do anything for India positively, I think if it can get the court to get its entire process, not just having video conferencing for your cases, not just having disputes move online, but for example, delivering judgments online. Having the transcriptions of what happened in court between people. What did this lawyer say? What did that lawyer say? What did the witnesses say? All transcribed and made available online for everybody to review. The the kind of potential for startups to come, look at that data, build on top of that data, create some incredible systems that can, for example, predict your liability in a case even before a judgment has come out. There's so many different things that we can do, applying machine learning, AI on top of all of this data. The potential is immense, and we can really turn India's judicial system from a fossil into a real showcase of innovation in India. That's really the mission that Agami has taken on, and we've accelerated on that mission ever since COVID-19 sort of hit us. What we've also noticed is, outside of what Agami's been doing, all of us at Agami have sort of been working outside of our offices to get together with communities to find out what it is that they're really hurting from, right? We've had a couple of calls. We had one call with people who were doing work with daily wage laborers. If I recall, Gautam was on that call along with Sachin and I, where we were just brainstorming ideas and trying to see what ideas could be funded, what ideas required scaling, what ideas required volunteers. That led to the creation of a Telegram group, which is more or less running on its own right now. We then did a second call with small and medium-sized businesses, where again we heard several businesses, about 40 to 50 of them had attended the call, just to understand what their pain points were. We took some of these pain points to our third call, where we invited global leaders of business from Unilever, from various other multinational companies who were dealing with, who were trying to deal with, this crisis in the best way possible by not laying off people, not retrenching people. And we were trying to come up with a paper that we could share with a lot of these businesses on strategies that they could use to extend their cash runway so that they could survive a little longer without letting go of their staff. So that exercise is ongoing. We're still doing that with small and medium-sized businesses. We've done a series of webinars, and we're continuing to do a series of webinars with the judiciary. We did two with Dalberg over the last week, where we invited some of the former senior judges, chief justices of India to a call, along with senior advocates, discussing the state of the Indian judiciary. That is now leading to a white paper that Agami is currently writing, which is scheduled to be presented to the Law Ministry, that will hopefully lead to the full digitization of the Indian judicial system. And hopefully we'll see the fruits of that over the next week or two. Thank you.
Thank you, Arun. Actually, even yesterday's discussion, we were talking about how cities are made or break because of pandemics or epidemics. And it seems like with your initiatives with law, you're completely, turning around law system around, the judiciary system around. Seems like a turning point.
My turn?
Yeah.
Okay. Yeah, it's fascinating to hear all these stories, and particularly very intrigued by what Sri Lakshmi said, and the communication from the government need to focus, shift into the responsibility or understand human behavior, and with the kind of police force that we have, and enforcement of a lockdown is near impossibility. It's just thanks to the huge trust and credibility somehow people have in the state, and sometimes not so nice methods that police use, we are having some sort of lockdown. But if it gets extended, unless it comes from within and people want to participate in it, it's not going to work very well. So I'm certainly going to look up to her to get some inputs on the communication that we are also trying to do on behalf of the government. In fact, one of the discussions we had is see if we can work on a theme called Nive Decide Mari. You decide what you want to do. You decide how you want to be in lockdown or not. You decide whether you want to wear a mask or not. You decide whether you want to, so pushing the focus towards people rather than, getting things into government declaring what to do and that kind of stuff. So we'll see how that goes. But let me focus on the second question on the list. What are the associated struggles and challenges on the grounds of developing nation? How are the cities dealing with it? So this is where my work with CFB and with Bengaluru all come together for me, personally speaking. And you saw that beautiful map that Gautam and the Reap Benefit folks have put up. you would think that such kind of a map already exists, right? You would think that some kind of thing like that is already there with the government and the government agencies, and that's how they are planning their work. But it doesn't. They seem to work in their own world, and often they ask questions like, okay, so where do we have people to migrant laborers to supply rations? Can you imagine government asking questions like that? By now, they should know all of these things, right? If you talk to any politician, even the local politician that contests the councillor or corporator election in a ward level, will know exactly where the people are in his or her ward. Who are the people from Bihar? Who are the people that speak Odia? Who are the people that have ration cards? Who are the people that don't have ration cards and multiple ration? Every last bit of information is existing today with the local government bodies and the political parties that work with the BBMP or GHMC or whatever the corporation is. And yet that is not being used as a way of disseminating either information or rations or relief efforts in general, right? It has to come from some big war room, control room, centralized. You see big screens and all kinds of things. We just don't understand the concept of theory of subsidiarity, right? The theory of subsidiarity tells you that the people at the lowest level are best equipped to solve the problem. And this is just not understood. We all look towards the Prime Minister's speech or the Chief Minister's tweet, but we don't look towards the local BBMP health inspector, what he's saying. What are the market, how to organize a local vegetable market should be entirely in the hands of the BBMP councillor. The ward committees have 10 people in them in Bengaluru. The 10 people of the ward committee are residents of that ward, and 2 of them are women, 3 of them are women, 2 of them are from SCST and RWAs, and it's a well balanced representative of that. Imagine that group of people are asked, how do you implement lockdown here in an effective way? How do you ensure that Anganwadis in your ward have steady supply for the pregnant mothers, lactating mothers, children? This is the food security system India has built. We have the midday meal system, we have the Anganwadi system, all of these things. But who runs them? Who makes them work is at the lowest level, the ASHA workers, the Anganwadi workers. But in this fight against COVID and all of that, you don't see much of them. Today there was a news in the Bengaluru newspapers. I'm assuming most of you are from Bangalore. The 11 Paura Karmikas were traveling in a garbage truck and they had an accident, and 2 of them are in hospital now in critical condition. So when you decided that 17,000 Paura Karmikas are going to work every day, they have to pick up the garbage. Otherwise, how will all of us who are sitting in our nice homes get rid of the garbage? Now we are producing more of it by cooking 3 times a day, right? So they have to work. How will they get to work? The bus is gone, autos are gone. So they take less than safer modes of transport. And so this is where the governance fails, right? You're not thinking about the last person in the thing. And the other thing is about when the migrant workers are trying to go home, right? We all saw those dreadful pictures. They still continue. Somehow that story disappeared from the national mainstream media. Occasionally you'll hear a story of the young kid Mahesh Jana who just bicycled 1700 kilometers from Maharashtra to Odisha through Telangana, through Andhra. He just went to Odisha only to be banned by his village people. They said you can't come in. So they put him in quarantine there after he went cycling on. Why are these people going there? I think this is a great opportunity for all of us to stop and think what makes them go there. Why is it that when Aishwarya or Padma Shri go to Delhi to get a job, or I come to Bangalore to have a job, what do? I get a home, I rent a home. If I can afford it, I'll buy a home. I'll make Bengaluru my home. I get a school for my kids. I do whatever you need to do to move a city. But when the migrant labor do the same thing, they're also coming to the work. But how come they end up living in asbestos sheds and horrible working conditions? Even the metro workers, 10 of them sitting in one single room. When you say things like social distancing, it means so little to a lot of a big chunk of India. And this is an opportunity for all of us to understand that. It is not something that you can solve today. I recognize that, acknowledge that, but it is something that we should seriously think about. And when you think more about it, and this, I know that many of you are planners and architects, what the hell happened to affordable housing, man? What happened to that? this yojana, that Awas yojana, thousands of crores given by central government, state governments. Where are all those homes? I want to know. Why is it that if you go from Odisha to Maharashtra or come from, Assam to Bangalore to do work, you can't find housing? Why is it that? Isn't that a promise that we made to ourselves when there is a, whatever 20 million homes for home for all is the goal for the national government by 2022? That's just 1.5 years away from now. What happened to the affordable housing projects? What happened to the lakhs of crores of money that is always allocated in various budgets? Is it even being spent? What is going on with that? And is it how you want to build your cities? Is the city going to be only for those that will wait for the garbage collector, or the city is also going to be for the garbage collector? Is it only for the people that buy these apartments and rent these apartments and do all this co-working and all kinds of nice things? Nothing wrong with that. Wonderful stuff. But is it also for people that come here to build our metro and to build our roads and to build those apartments? So these are the things that we don't pause to think about, and we just move on because that's how it is, right? The market dynamics and market economics and all that. I think this crisis, gives us an opportunity to think through these things and make others around us, especially young people. And I'm going full on with this because I know that there's a lot of young people here. You really need to think through how we got here, right? Why is it that people throng to the bus stands as soon as UP Chief Minister says we are going to run some buses? Why are so many people running away? What makes them do that? Do they not know about this corona pandemic? They do know. I mean, they may not know at the degree that some others in this panel know or participants know, but they know that it's a danger. So it's a risk assessment, right? They're able to assess the risk of staying here. Mahesh Jana's story is a classic story. He earns 15,000 rupees in Maharashtra doing some work, construction related work. It's in the front page of the Hindu today, and many other medias carried it. 15,000 rupees per month. It costs him 6,000 rupees to live in Maharashtra. 3,000 for rent, 3,000 for, food. So 7,000, obviously 8,000 is sending home, 6,000 here. He has, the day of the lockdown, he has 3,000 rupees in his pocket. And his factory got shut down, or his workplace got shut down. It was said that 3 months it's not going to be come back. It's rumors, but at least undetermined amount of future time, there won't be any income. So he said, what am I going to do sitting here? I can't do anything here. So he somehow found a bicycle and cycled away. 7 days, 1,700 kilometers, he made it. So that is a choice he's making. And this is just one story, but there's so many stories like that. And, I don't want to, replay all the horror stories that you're hearing about the mothers carrying the babies and all of that, but that is where we are. So the bottom line is that we failed to build our cities as homes to everyone that come to the cities. It's only home to some of us. It's not home to some others. And that some others is not a small number. It's a very big number. If you look at it from a governance point of view, it's a complete failure or lack of understanding of how important a local self-government is. Because when you give priority to the municipal corporation or gram panchayat or town municipality or those things, those are the front runners in any pandemic or epidemic controlling, containment, isolation, markets, sanitation. The health inspector of a BBMP ward knows every single restaurant, every single pushcart vendor, 100 variety dosa maker. He knows every pani puri vendor, coconut tender, coconut vendor, all of that. If they are empowered to do the work, they will be able to get it done. But we don't. We always look up to, and as citizens also, we make this mistake. We always look up to, some prime minister and chief minister and what are they saying and what is the data showing and things like that. So we really need to change the way we think about governance and who actually delivers governance. The more the local, the smallest unit of the governance delivers, implements the plans, the better it will be because they are the closest. The more so-called developed countries, which are no better prepared than India, as we now discovered, but if you look at the way they are executing their strategies, the US Fed has just released $2.3 trillion as a package, economic stimulus package, I think that's what they call it. Half of it goes to the small enterprises, right? Like the equivalent of the Pani Puri vendors. Obviously, US doesn't have the Pani Puri vendors, but the equivalent of that. It is for them so that they don't have to pay their loans and they can come back when this is done. Other half goes to municipalities, municipal bodies of small towns, cities everywhere throughout the United States. Why is that? Because the cities have to drive the economy back to life as it goes, and they are the ones that are supplying the PPE kits to the local hospitals. We don't even have the concept. The PPE kits have to come. The central government has to approve who can make PPE kits, it seems. We didn't even have enough testing centers because everything gets controlled by Delhi. How will we ever fight this thing if we are so many billion people have to look towards one little department to approve, while all the work is actually executed by the state governments and below that? So fundamental structural issues in governance level get exposed in a pandemic like this. And this is the more we think through that and dialogue that with others, the more we'll understand this. I'll close it very quickly. I won't talk about TikTok because that's probably not relevant to this panel, but I saw some questions. I'll answer separately. On the issue of the mapping that Gautam is doing and others were talking about, the problem we found with Bengaluru is that as people are desperate for help, right? We have 100 people in this colony, haven't eaten in 2 days. This is the message you get on the WhatsApp group. You will cry if you are on WhatsApp group because every couple of hours you get a message. This family hasn't had any food for 3 days. Can somebody go there and supply something to them? Very innocently, a message will come. 5 families, this many kids, this many people, they are here, they're stuck. Many people don't even realize that some of them have no access to go anywhere. Even if they have money, they don't know where to go and buy stuff because they came and they were settled in a kind of a labor colony where they're doing some work. Somehow things were working for them. Suddenly they're cut off with the civilization. And this happens in world's most dynamic city, Bengaluru. Right? It's very hard for us to imagine. Somehow through some NGOs and people that are already working with the disadvantaged communities, trans people, all kinds of issues are out there and they are coming in. And we are looking at it as ordinary citizens trying to do our bit. How far can you go? Where do you go to help? So we are thinking, and this is what Gautam was showing earlier. I think it's one of the best things that has come out of this effort. I don't want to jinx it because it's still very early days of what they're doing, but it's a brilliant effort in trying to connect the people that are in need to the people that can actually support. And if you can do that in a scalable way for a 1.3 crore people level, then we can solve a lot of issues. In fact, that should become the model for governments. And I know Salila has asked whether there has been any attempts by the government to bring all these people. Yes, they have been. They have held some meetings and asked some of us to come, and there have been representatives from different NGOs and helping groups to do that. And government is really doing a good job. We all must acknowledge that, no doubt whatsoever. Except that they just don't have a pre-existing plan around it. There isn't a disaster management plan. Forget COVID, right? If something else happened, you still need a plan to deal with that thing. As this unfolds, we're realizing it doesn't really exist. So it's easy to criticize and point fingers when things are really in bad shape, but it's very critically important for us to acknowledge and document and try to pursue them as we go forward. We have to live with this COVID thing for a year or two now, right? Hopefully all of us will live through it, but we have to live through it. It's not going to go away just because the lockdown is done. It's not going anywhere. We all know that. It's just a temporary band-aid they're applying with the thing. So we better use this opportunity to change how we organize ourselves in terms of, working and getting the help. The job of any elected representative, elected democracy, job of any government is to ensure that the last person in the line is taken care of. It's not to ensure that Anil Ambani gets his food or gets his loan waived, but the other way around. So if you design the system that way and now use the technology that you have available to connect these two things, it can work in many different ways. You can communicate positive messaging, you can enable livelihoods even in this period. we have made a decision yesterday, just last night, that here on out, if a request comes in, let's say from, I don't know, Bommasandra, 10 people need rations, 10 families. We don't want to take rations to Bommasandra from St. Joseph's. We want to find somebody in Bommasandra who can give those rations to them. That's it. So get local people to handle local solutions, local problems in their own way. Time is saved, money is saved, and there is a trust and a community partnership and ownership that builds in that transaction, if you call it. And going forward, there is a camaraderie in that community. We don't know how to do that. The map that Rape Benefit is doing is one dimension to that. But everywhere you see in Bengaluru, many people are doing these things. When I mentioned that a message comes that somebody needs help, they're hungry, I should also mention that within 5 minutes you get 5 messages. Okay, we got it. Our person is going there. Oh, I called them. They already got it. You see these messages also immediately following the original message. So what does that mean? That means, well, at one level, humanity is still existing. Another level, this kind of collaboration is working. So how do you formalize it at governance scale? We don't know that. We don't know these answers. In the Karnataka Municipality Act, we have these ward committees. I won't bore you with about ward committees, but I must tell you that one of the responsibility of ward committee is to create a disaster management plan for that ward and execute it when the disaster strikes. Look at the foresight of the people that have built these things. 20, 30 years ago, these things have been written into law. We couldn't even get a ward committee functioning until last year. So where will the ward committee actually be productive and create a disaster management plan and execute it when the time comes? So we have things on the paper, we have intent in a lot of people. Somehow we have to marry all these things. And the best thing we can do is to create a lot of people like ourselves, people that are part of this panel and people that are listening to this, to ask these questions, to call your local councillor, ask, hello, madam, what's going on in our ward? Is there anything I can do to help? Ask that. Don't tweet Narendra Modi, what can I do to help? There's nothing he can tell you. But you definitely ask the councillor, he or she might be able to actually tell you what you can do. And that also creates a cycle of political accountability and all of that. So I'll stop here. Thanks.
Thank you very much. So I think what we're hearing is having more hyper-local focused activities, but maybe expertise like what Gautam is doing or what Varun is doing, those become more virtual in nature, but factories and supply chains and immediate reaches become hyper-local. Is that something that I think all the panelists are touching upon? Most of the questions that we got have been answered immediately, I think. How is everyone with time? Should we wrap it up? Or?
I have to leave in 5 minutes, so I'm happy to take questions. So.
Who was that?
That's Varun.
That was Varun.
Oh.
Yeah, I think I just wanted to say that one of our professors, Anuradha ma'am, has said on the chat that the legal texts are already digitized and it's available on the NLS site in Bangalore. So that was one information that came in.
If you could just comment on that.
Varun?
Sorry, I didn't hear that. Could you repeat that, please?
Yeah. So one of our professors, she says that the legal texts are already digitized and they are available on the NLS site in Bangalore.
Got it. So, it's not a matter of whether the legal texts have been digitized or not. We're talking about, so when we talk about, the digitization of the courts, there are many different levels of digitization that we're talking about. So, for example, we discussed the proceedings of the court being done online on a platform. So, the term digitization basically means that when something is done, using an analog platform, it is later then converted into a digital platform. That is one way of going online. What we are trying to advocate is that everything happens online first. That is a fundamental shift in the way the court functions. So all proceedings happen online, transcriptions happen online. So therefore, when a hearing is done, all of that data then is already available, published online. There's no lag. We're not waiting for an intermediary to then look at all of the stuff that the code did and then try and digitize it later. You understand what I'm saying?
Yeah. All right. Yeah. Thanks for commenting on that. Yeah, I think we have. Do we have another question?
I just want to comment on, share something on what Srinivas had mentioned. One of the ways we try to connect in Trichy for my grandparents was I was searching for the local supermarket shop, Malige shop, and usually we have the neighborhood people will have a rapport. So through connects, you find a local shop, and though they are shut, they take calls and whatever they were able to provide privately to known people, they are providing. So I mean that's one of the ways you could look into connecting and putting them on the map.
Right. Okay.
Kerala is the role model for local governance, absolutely.
There's another question. How do the people economically weaker section get access to these kinds of information? Could someone comment on that?
Which information?
We're talking about digitized information, perhaps even what
Legal stuff.
Varun was talking about, and even what Gautam was talking about.
Right now, there is no central place where all of this information is available, which is why we're trying to create that space. If you're interested in that particular project, you can Google the Justice Hub, or you can visit agami.in, where we have information on all the initiatives that we're running, where the Justice Hub is one of them. We are actually piloting the Justice Hub in about a month's time. So we're hoping that we'll have some sort of a beta version. We have about 5 to 6 organizations that have initially signed up to put their data out there. This includes Tata Trust, Daksh, Vidhi, and a bunch of other organizations as well. So you can follow the developments of that project by visiting agami.in.
Right, thank you.
I think with Gautam also, how do you plan on getting a more inclusive system running? Right now, I understand that it's more sourcing the information from people who can access it, but is there a plan on how do we make it more inclusive? Is that something you guys are focusing towards?
So it's a great question. Right now, our challenge is the current access to technology, with the reality that we cannot step out of the home for now. All we can do is rely on the goodwill of people to use some of these forms on the site, which allow you to kind of nominate people whom you know are needing help. Right? Could be your mate, could be your chai wala, could be your chat wala, could be the guy who gives you, who irons your clothes. Most of these guys, you will have their numbers, and you might be able to reach out to them and identify more people like that. That's one way of doing it. The second way is to kind of maybe work with somebody, which we are thinking of how to do, somebody with a call center, so that I think what Srinivas said about people not being able to know where to get support is a very, very strong point. So is there some way you can kind of send bulk messages saying, hey, call this number if you need help, it's a call center, and basically enable them to map themselves to say this is where they are and this is where they need help. I mean, these are the top thoughts as of now. We are completely open to ideas, because the whole point is, where do you discover people who need help? How do you make it usable for them and make it more inclusive? I mean, yeah.
Gautam, just a point on that. It has a lot of welfare programs from the government. Most information reaches them through audio calls, and it has proved very effective in the information reaching them and it turning into an action, particularly because you may mostly encounter illiterate or low literate individuals.
Correct. It's a great point.
I think
IVR
Varun
option.
is going to be
Would want to kind of
leaving the
understand
chat
more.
soon.
Sure.
Thank you, Varun, for being here. I think Varun's leaving.
Oh, thank you very much.
Thank you, guys.
Thank you,
Thank you.
Varun.
If anyone else also on time, let us know how it's going. Otherwise, we'll wrap it up in another 2 to 3 minutes, if that's good. As soon as Gautam gets to answer.
So like I was just saying that we are exploring IVR options as well. But again, that's something we are exploring because we need to have a very clear, concise message to put out and a very clear, concise set of questions to ask, which will enable validation to happen over time. So that's where we're coming from.
Yeah, I have a take on this, this technology enabled things and whether that means inclusive or not. It's clearly not inclusive. Even if the person has access to a smartphone, using the information in a way that we want is almost not possible. But I think we don't need to look at it at that angle right now. It's probably an evolution that will happen anyway. But at the point of where we stand right now, the idea is that you have lot of issues, right? And you need to be able to structure them, streamline them, and process them. That's where technology comes into picture. Whether the person who is from Bihar and he's able, so we, for example, we got all these Bihar. So we have a hunger helpline in Karnataka, Dasoha, and all that. 15, the phone number and where you can go and all that. And some of us, our friends, got it translated to 7 languages, from Odia to Bengali to Assamese, everything. Great idea, right? But how will that person get it? Where is she or he going to read it from? In a non-COVID kind of situation, you can say you make big posters of them and stick it in slums or whatever you can say, something like that. In today's situation, how will you get there? Is any of us in a WhatsApp group with people in slum? I don't think so. So the way to use technology right now is to find that person who is taking responsibility for a marginalized community or individuals. Get them on the technology platform. Don't worry about the actual recipient of that thing, right? So this is how you operate right now, and things like privacy, data, all of these things are very, very complicated, complex things we need to think through. And sometimes when you have situations like COVID, you throw caution to wind and do whatever you want, like government does. People are sharing PDFs with all the people that traveled outside the country. People are all the people positive tested people's names with phone numbers and home addresses have been distributed on WhatsApp. We have no concept of any of this. So the better to kind of control this flow of information in a way that the caregivers and the people in the society that are working towards this deal with it in a responsible manner. It's not perfect solution, but it's a workable solution in the time being, in my opinion.
I think we
On
had
that
that.
chat. Yeah.
Actually, we did have a list of the positive cases being circulated on WhatsApp, or maybe it was just something that people who were already on the list of people who had come from abroad, like for example, I was, and I was stamped everywhere, and I'm still under observation. Maybe that was something that was just accessible to some people like me. But
No, it was there. It was there from both. Even Trichy had, Chennai had, and Bangalore had, which was a good thing. But I don't know. It would have been better if it was visual, but it was a good thing because then we know that, okay, 100 meters down the line there is someone with COVID, so it's better that you don't step out.
Yeah.
All that.
I think I'd like to ask Dr. Naveen one last question, then we could wrap it up.
Yes.
Sir, with all this discussion about communication and last mile communication and getting work done, how do you think the medical community could benefit from these activities that are happening, whether it be taking things virtual or, making things more hyper local and having Citizens for Bangalore creating advocacy and activities?
No, I think it should be a bit of both. Now, technology has penetrated, but not last mile connectivity is still a problem, as many panelists have pointed out. But I can share our experience with our patients. Now that OPDs are closed, patients don't have access to the outpatient department. So what we have done is to proactively call them. About we have identified in the past 6 months or so, I think we have identified about 12,000 patients, and we have phone numbers of all of them. And then we try to reach out about 6,000, 7,000. We are able to call them and find out their well-being and what they're doing. The other, because of at least 30% of them, the numbers are not reachable, or the wrong numbers have been given. So that is a problem. So using the telephone itself, we've been able to just know their status, and we've been able to advise them to continue the medications if they are stable. And of course, last mile connectivity is an issue, because smartphones, if for telemedicine, at least a smartphone is essential. And the smartphone thing is not yet reached the last mile at all. Let me be very clear on that. So for them, we are trying to link up with the local resources. For example, Bangalore patients who don't have any smartphone or whatever, we are trying to link up with BBMP dispensaries. 11 of them we have identified, and we have stocked up our medicines there, and the BBMP also can procure our medications, and we are trying to link up with the doctors and the pharmacists there, so that the nearby dispensaries, they can go and procure the medications at least. So I think it should be a bit of both. So hyper locality also should be there, and we should leverage the technology also. I would say I would vouch for both approaches.
Thank you very much again for all our panelists for coming on. Srinivas sir, Sri Lakshmi, Naveen sir, and even Gautam. Thank you so much. This was a productive discussion. We'll probably bother you guys again as to how we can maybe take it forward. And
Right.
yeah, thank you. Have a good night.
Yeah.
Hope you stay
Thank you
safe.
so much.
Good evening.
Good night.
Thank you. Good night, everyone. Thank
Good night.
you.
Good night. Bye bye.
Wait. Hang on.
I have to cut live stream from YouTube.
Live.
1 second. We are live on YouTube. I'm going to.
People who
Goodbye,
are still-
everybody. People who are still here with us.
We've got to go. Goodbye.
My
Okay,
dogs are packed.
Where did she go? We're still live.
I think you
Shall I
should, leave.
end it? Bye, people.